I don't think you can overreact when you're talking about safety of students on a school campus, so as a precaution, we're just locking down our building.
The principal of East Valley High School on his district's lockdown today. A former student leaves a note threatening to kill his girlfriend. Hours later, he is found dead in a field near East Valley Middle School. Today's incident at East Valley is just the latest in local cases tied to poor mental health. Suspects battling schizophrenia, bipolar disorder, and depression. There was a murder of a former local music teacher, Mark Williams. The suspect is his own son, Brian, who suffers from schizophrenia. There's the ongoing trial of former Mount Spokane High School student Brian Kim, accused of killing his parents. He has bipolar disorder. And today's threat and suicide outside East Valley High School has some wondering about the help available for these young people. Tonight, KXLY4's John Langeler looks at why we may be seeing so many instances of mental health patients turning violent. John?
Robin, back in August, we took a close look at the teen mental health problem in Washington. Critics say the system neglects teens, and those that do get help don't get adequate care, leading to dangerous adults.
Forgotten, I think they're shunned by the mental health community.
Last summer, retired counselor Diane Hammer gave this sobering preview of the future for mentally ill teens.
I'm telling you, you're going to have a generation of mentally ill people on the street.
Today, Hammer's opinion hasn't changed.
I think it's definitely a sign that that unless we do something with our culture, pull it around, do some nurturing for our children, actually putting children first.
So are the recent incidents really a sign? Are crimes tied to mental health a sign of the long ignored and underfunded problem now in the public eye? Dr. Lou Sowers from Spokane Mental Health says no.
Unfortunately, it's just something that happens. The good news is there are a lot of effective treatments when it does happen.
He says there is room for improvement and more resources, but there are programs available. It's just hard to get young adult men to participate.
If they don't take their medications or they try to self-medicate, say with alcohol and or other drugs, illegal drugs, that just makes a bad situation a whole lot worse.
Counselors say the system is the problem. It's confusing. There's not enough money. Some of the most troubled teens get ignored.
I think there's a greater risk with teenagers who are not being helped or identified or assessed for risk.
Brian Williams, Brian Kim, Cole Strandberg, all in their late teens and early 20s, all with mental illness and difficulty taking medication, all now facing criminal charges.
It's going to be a very dangerous world, and then maybe people will pay attention. But in a lot of ways, it's going to be too late.
The state has started putting more funds into teen and young adult mental health, and because of that, there are more programs available for those that need help.
Okay, so what kind of help is available?
Well, we spoke with Spokane Mental Health today. They have a number that you can call if you need someone to talk to. That number there is 838-4228. They also have new programs available for people looking for somewhere to turn, and we have a link to Spokane Mental Health at our website, kxly.com.
All right, John, thanks so much.
Yep.